Some care homes were struggling financially even before the outbreak of coronavirus. But Sky News can reveal a group of care homes in the northeast of England have taken the unprecedented step of legally warning the council if they don't take action to help them financially within 5 days, the market will start to collapse. We've obtained a leaked copy of a letter from 21 care homes to North Tyneside Council declaring force majeure or a major incident. The letter says the care home market within North Tyneside is facing imminent collapse due to the council's conduct in the lead up to and during the current COVID-19 pandemic. It goes on, the council has failed to provide sufficient and timely financial support to care home providers to meet the additional costs they're incurring due to COVID-19. As vacancies increase due to deaths with fewer and fewer, if any, new admissions, the running of homes within North Tyneside is becoming increasingly unsustainable. The largest representative body for social care in the UK is Care England. I asked them to comment on the letter. We already knew that the care sector was really struggling financially to deal with this pandemic, but how much more serious is it to declare a force majeure or a major incident?
Declaring this force majeure is something that has never really happened before. So this tells us that we are in the midst of perhaps the worst situation we have seen in modern times.
What would you say to people who have relatives in care homes and nursing homes in this country?
Care providers will be doing everything to make sure that the care is as good as it possibly can be and that people have good lives. Where they should worry is whether or not these services are sustainable for the long term.
Declaring force majeure essentially frees both parties from their obligations under the contract due to extraordinary events.
In certain specified circumstances. Those circumstances would normally include such things as war, riot, acts of terrorism, earthquake or flood or whatever.
In a statement, North Tyneside Council said, "We're working hard together to keep staff and residents safe. Occupancy levels have been affected by the pandemic and we're aware levels have fallen below where they were ordinarily expected to be. Where this has happened, we're working with those providers directly in line with our statutory duty." It's not just the northeast of England where anger is growing about the costs of combating coronavirus in care homes.
We were buying from independent providers. I know some providers who have got stung with the scams. Large groups have paid large deposits and lost those. We were thankfully ahead of the curve, so we had sufficient to keep us rolling, but then we were paying exorbitant prices for masks and gloves.
Some care homes say they feel they've been pushed to take drastic action and they're still fighting the devastating impact of coronavirus. Lisa Holland, Sky News.